All right, Dr. Darien Sutton back here looking at a top health and wellness issue right now. So this one's from Lisa R. And she says, when do I need to get a CT scan after hitting my head?
Possibly one of the most common questions I'm answering in the emergency room after you have some type of trauma. The next question is, do I need an image? And there are some things that I'm listening to when we're asking about a story. For example, after you fall, did you have a loss of consciousness? Are you acting normally right now? Do you have a headache? Are you vomiting? In terms of age, that's also important, and also your memory. These are some important factors that when we're listening as physicians, we're figuring out our risk factor categories and trying to figure out whether or not this person is high risk or low risk. Now, if they are high risk, meaning that they answer yes to one of those questions, we'll likely get an image like a CAT scan. And it doesn't just have to be those variables. It can be other things that just make you suspicious. I use the hair on the back of my neck. If it stands up when I'm listening to a story and it feels something somewhat concerning, then I'm going to get a scan. And most often, head trauma does not need a scan. Most often, if people hurt their heads, they're acting normally, they don't have any loss of consciousness, they have no risk factors, they don't need a scan, but it's really important to have that conversation about your history and your risk.
All right, really important stuff. All right, thank you, Dr. D.
Of course.
And we want to hear from you, so check us out on Instagram right there. Hit us up with all your medical questions. It's at ABCGMA3.
I had to refrain from saying, can I show you my bruise?